And my name is Fabian Antoine Nasser. I am with the American Cancer Society Cancer Action Network. One of the things I didn't hear about recommendations, and one thing I want to uplift again, would be the shutting down of the Georgia Tobacco Use Prevention Program. We know from the Center of Disease Control and Prevention that there are fact-based recommendations that a comprehensive tobacco control program provides states with the needed framework to educate people on the dangers of tobacco use, as well as connect people who are already addicted to tobacco to resources to help them quit. Unfortunately, on May 30th of this year, as you guys know already, this program was shut down here in Georgia. And overall, for every $1 spent on comprehensive tobacco control programs, states receives up to $55 in savings from averted tobacco-related healthcare costs. So we would love to see this, whether it's represented within any legislation specifically geared towards the tax, to see how we can get this program up and running again. I think if we don't have it running, it's going to have adverse effects on Georgians.
Okay. Ask what the rationale, did the feds give a rationale or just close it?
Budget cuts,
Well,
CDC budget cuts,
I
but
mean,
yeah.
What?
Doge.
Okay, then, but no, I mean, like, there was no thing that they didn't think it was working, too much money went to it.
It was not a priority
Wasn't a high priority, whatever.
for the administration.
Okay,
Yes.
what?
They were federally funded positions through the Office of Smoking and Health.
Mhm.
So that's why the department was let go.
So my question was, do you know what that cost was that the federal folks cut?
2.1 million a year.
0.1 million,
We were only at 2% of the CDC recommended.
exactly.
So, in terms of a policy piece, we would, what I would imagine we would discuss as a body is if this is a priority for us, which I think it should be because it does save our state money in the long run, is whether, as opposed to a bill, to discuss it as a investment through the budgeting process, if to cover the 2.1 million that we lost from the federal funding.
Okay, and what did you say we were only at 2% of something, or what was it?
CDC recommends a certain amount of money in funding, and we were only at 2% of what was required.
Recommendation.
The recommendations from the CDC.
Did it already.
Yes.
Okay, and now that's gone.
Yeah, even though we
Yeah.
had that, I mean, we've decreased our smoking rate tremendously in this state from just $2 million.
Exactly.
So we could do so much more maintains, and double that would be very
Okay.
nice. Which
Thank you very much.
You're welcome.
Anyone else who wants to? Okay, so let's, if y'all want to give Andrew the recommendations, and then let's look at this before we drop legislation. Like that, so that we can.
We can't even.
No, I know, but I mean, we'll work on it and see where we can go from there. Okay, you ready? And for it, Andrew?
Yeah.
Well, and with that, I mean, certainly something near and dear to my heart and everybody on this committee, Representative Stevens and Al and Debbie, and we are all would like to see the state move forward on this.